Hi, my name is Allie Hunter, and I'm the Executive Director of PAARI, the Police Assisted Addiction and Recovery Initiative. In today's video, we'll be sharing some fentanyl safety information that'll help address some myths and help you to stay safe while providing life-saving care.
Hi, my name is Sarko Gergerian, and I'm a sergeant with the Winthrop Police Department. My department is one of many that provide support and referrals to community members who struggle with substance use. Being on the front line, we are more likely to encounter fentanyl, and it's important to know the facts. When worn correctly, personal protective equipment, PPE, provides the proper protection to minimize the risk of potential fentanyl exposure. PPE will vary department to department, but gloves are considered to be standard PPE when handling any substances.
Hi, my name is Wilson Palacios, one of the research partners on this pilot with PAARI and the Department of Public Health. Now, there seems to be some misinformation out there on fentanyl safety. One myth is that just touching fentanyl and its analogs could cause drowsiness, illness, or even an overdose, and this is not true. Even if you were to cover both of your palms in pharmaceutical patches specifically designed to maximize delivery of fentanyl through the skin, you would still not rapidly receive a high dose of fentanyl. While this is an extreme example, it illustrates that fentanyl does not absorb well through the skin, and incidental skin exposure is unlikely to cause an overdose.
Incidental skin contact with fentanyl should be washed off immediately with lots of cold water. Alcohol-based hand sanitizers should not be used for decontamination, as they do not adequately wash opioids off the skin and may increase absorption. Don't touch your eyes, nose, or mouth until after you have thoroughly washed your hands.
Another myth is that you can get sick from being in the same room as fentanyl, and this is not true. Fentanyl and its analogs are unlikely to be in the air, as powered opioids are not readily dispersed. It's important to know that symptoms of fentanyl overdose are different from a stress response. The signs and symptoms of a stress response are shortness of breath and a racing heartbeat. The signs, however, and symptoms of a fentanyl overdose are drowsiness or unresponsiveness, slowed breathing, and constricted or pinpoint pupils. If you think you've been exposed to a substance such as fentanyl, you should immediately alert your supervisor or partners. If you present with any of these signs and symptoms, it is recommended to go to the hospital to get checked. Naloxone, also called Narcan, is an opioid blocking medication and should be administered to someone who is unresponsive and isn't breathing, or has very slow breathing, which is a telltale sign of an opioid overdose. We hope now you feel more equipped to manage potential fentanyl exposures and mitigate risks.